Welcome back. As Gauteng steps up efforts to tackle teenage pregnancy, attention is also turning to young people's access to HIV prevention and youth-friendly healthcare services. Let's look at that then, and the uptake of Lenacapavir among young people, whether services are accessible and youth-friendly, and how the rollout connects with the province's teenage pregnancy awareness campaign and community activations. I'm joined for that discussion by the Gauteng Department of Health spokesperson, Steve Mabona. Good evening to you, Steve. I was looking at your couching. You had a campaign in Ekurhuleni around these two themes, Lenacapavir as one of the interventions around HIV and AIDS, as well as teenage pregnancies. And I couldn't help but get the sense that you are deliberately coupling these two campaigns for a particular reason. What's that reason as it relates to this particular demographic?
No, definitely. Good evening to our viewers as well. They're intertwined because when you look at the Lenacapavir, it's more preventative. And we are saying there's a study which gave us information that especially Tsakani, there's a teenage pregnancy there. The numbers are skyrocketing. So if we don't intervene, we're going to have serious challenges. So then we felt that let's then launch our rollout in that area, but also target learners who are still at school. You might have seen pictures on that event. It was learners that we were talking to, though we encourage parents to come, but we felt that let's give them the platform and also put an emphasis that our facilities are, friendly to young people because that's our target. And we have seen that, they came in numbers and will continue in the other areas. But we felt that let's launch in that area because we do have some research which indicate that there's a problem in that area.
So the one element is the teenage pregnancy problem, objectively, that you as a province face and other provinces as well. The other one being the spread of HIV and AIDS. Is it your reading, consistent with other data coming through in the health sector, that teenage girls in particular are vulnerable?
No, definitely. They are in the risk group that we've classified. Remember, we said we need adolescent, young, children and your women and boys. We said, the LGBTQI, plus community. We said the sex workers and those that are injecting, substance abuse. And we felt that category, if we start there, we will make sure that by 2030 we don't have AIDS in the country. So our numbers are dictating that people are coming in numbers, and our targets are actually responding very well because we are receiving the probably last dose from national of the Lenacapavir.
Sure.
So we will be making sure that we roll out. But yes, indeed, those are our targets.
So when you say your institutions are child-friendly, what does that mean in the context of a subject matter that not usually, in fact, all the time, requires the buy-in of the other stakeholder in the equation, being the parent, and the misunderstandings that have occurred in the past, and I'm sure you know exactly what I'm talking about, where some of your programs have been misunderstood by parents. To avoid those misunderstandings, how much buy-in is there, in particular for this message, which seems to be, a twin message?
We work very closely with our sister department, Department of Education, looking at SGB's involvement in the program to say, the school health program, it's more about imparting knowledge, but also taking a basket of services, because we don't go to schools and say we are, administering, HPV vaccine and other vaccines that we are administering because we need a consent from parents. So parents need to be, with us to say the messaging is more of preventative. We want our children to be safe. Like for instance, your HPV. I mean, those children might not contract, your cervical cancer in the near future. And we've seen, the numbers dictate that Some women, they learn or establish very late that they might be going to have, the cervical cancer. So it's quite key that we encourage them to come.
I suppose, Steve, what I would want from you is a clear message on the role of consent in this equation. The misunderstandings I was alluding to include what arose at the beginning of last year, where there was some understanding that suggested at the time, and you've since dealt with it as a department, that the message from the MEC was that children from 12 onwards may be compelled to be on contraceptives, and that caused a bit of a storm. But you dealt with that misunderstanding. So I suppose let's do exactly the same. For the parent watching all of this and saying, you as a department went to speak to children, pupils about teenage pregnancies, as well as the rollout of Lenacapavir, sitting there and saying, well, what's my role then? Is my consent needed?
Yes, definitely. Your consent is needed. That's why we were putting an emphasis to parents. They read the consent form that we're sending to you and understand. And then when you consent, you know what you are consenting to. But really, here we need partnership from parents. Some will say you don't expect a child at 12, 13 years to be active. But we are saying we need to make sure that we protect them. And also we are working very closely with the Department of Community Safety to say those that are abused, they need to be, coming out to say there's an abuse here, including parents. If there's an element of someone who's abusing a child in a household, we should be in a position to come to the police and say, here's a problem. Because we can't have a child at 13, 14 being pregnant. It means there's a statutory rape that happened there.
Yeah. Lastly then, recap for us the rollout of Lenacapavir. My understanding is that you have something in the region of, 133 sites? Just talk to that. How's that going for the broader Gauteng population, but more specifically as well for teenagers in particular?
No, that is going very well. Like as I've indicated, we're expecting to receive just over 28,000 doses that we're going to be administering. We were left with just around 6,000, which we are administering, in all those areas. And we are encouraging our targets to come. And we've been receiving, inquiries from people who want to access some areas. They were depleted, but we made sure that they have stock, as it were. So the program is going very well, and we are encouraging those that are within the time frame of being targeted to really come and visit, so that we then administer the vaccination. It's more preventative. It's a treatment, actually, not even a vaccine.
All right. Steve, thank you for coming through. That's the spokesperson for the Department of Health in Gauteng, Steve Mabona, with an update on those two campaigns really around teenage pregnancies as well as the department's rollout of Lenacapavir.